Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Doctor, thanks for being with us again.
Hey, good morning.
So, experts are questioning the data from AstraZeneca, that vaccine. What is that about?
Well, that was a really weird set of results that was released yesterday. So this is the third company that's got vaccine data. They use a completely different type of vaccine than the Pfizer and Moderna one. And they kind of casually said, well, yeah, we have this overall 70% effect, which is not nearly as good as the 95% we're seeing with the other vaccines. That's, 25 points. And that the people that got the full dose only had a 62% response, and the people got half the dose had a 90% response. But that was only in a little over 2,000 people. So what is it? They didn't give any details or whatever, and as one other expert said, the only way we can figure this out is to read tea leaves. There's no data there. There's like, what is going on with the study?
People are flying more than they have for a long time for Thanksgiving. And there's a report in the New York Times says that this surge is really not coming from gatherings of people, but from nursing homes. Do you agree with that assessment?
Well, definitely some comes from nursing homes, and definitely some come from meat processing plants. We've known this for a long time. But the social gatherings, most of the people that even get traced, they can't figure out where it comes from. And social gatherings are either the ignition for the epidemic, or they're the scapegoat for the epidemic. It really is unknown and definitely needs further intensive epidemiological study to figure out what's going on, because it's so important and it affects our lives so dramatically. I mean, always keep in mind the basic things. People that are new to your little personal bubble should be wearing a mask and staying 6 feet away, at least 3 feet. That will be helpful. So, it's just, we don't know. It's a really good question, and it needs more study.
And doctors said the CDC should be warning people that the side effects to this vaccine, when it does happen, won't be a walk in the park. What does that mean?
Well, if anyone's had a flu shot or a tetanus shot or a pneumonia shot, and they've had some aches and pains, and, the doctor probably said, well, take an aspirin or Advil or something if that happens. These people who've taken this RNA vaccine have had really kind of a rough side effects. They go away. Everything is gone in a day or two. But I've had my experience of one patient that was in the Moderna study really got laid out. Now, I mean, nothing serious, but you're going to remember that day. And what they're afraid of is that people won't come back for the second shot.
Yeah. All right, let's take a look at viewer questions. Would you recommend getting an antibody test before receiving the vaccine to rule out any past asymptomatic infection?
Well, this is a kind of a tough question. We don't really know yet. Of course, in the studies, they got the antibody test. But in practice, is it worth going to the trouble to get the antibody test? Then the problem with the antibody test, as they showed in that fishing vessel thing in Seattle, half the people that had a positive antibody test without knowing they had COVID actually got infected. So, the antibody tests aren't perfect. So we have to wait to get more guidance on that.
All right, another question. My 2-year-old son tested positive Monday. He had a runny nose for a few days, but no other symptoms. My husband and I obviously didn't know all weekend, had been kissing and hugging him as usual. Should we even bother getting tested, or should we just assume we have it?
Get tested. We want to know if you are infected. Remember, most people that are infected don't have any side effects, just like the parents. And then they need to quarantine. So they are what we call high-risk contacts, or primary contacts. They definitely need to get tested.
All right.
And then their friends and family and stuff are secondary contacts. They don't, but they need to be aware that this is going on, and they should go get tested. If they get symptomatic, or if the parents turn symptomatic. So it goes like that. So the ones that get tested the most are what they call the primary contacts, like the parents here.
All right, next question. Once you're vaccinated, will you need to get a yearly vaccination like the yearly flu vaccine?
I don't know where those tea leaves. I have to find them. We don't know. Nobody knows how long this vaccine works. We're going to find out by the group, these tens of thousands of people. You know, these studies are enormous. Pfizer, it has 90,000 people in their study. The other ones have 40,000 and 30,000 patients. So they're going to be way ahead of the population. And they're going to follow them and find out when their immunity goes down or if they start getting COVID again.
All right, Dr. Murphy, thanks for joining us again. If you have a question for the doctor, post it on our Morning News Facebook page. We will talk to him again tomorrow. Thanks so much.
Thank you.
Bye-bye.
Hey, Paul.